Many people who eventually developed kidney failure had no symptoms for years. They felt perfectly normal. They went about their daily lives without any sign of trouble. Then, one day, a routine doctor's visit and a simple blood test reveal a serious problem. Their kidneys, the vital organs that work silently in the background, are failing. This quiet nature is what makes chronic kidney disease so challenging. Because you often cannot feel it in the early stages, you may not know you have it. Understanding this disease is the first and most important step you can take to protect your health. This guide is designed to make that understanding easier. We will walk through this topic together, step by step. We will use simple language. We will avoid confusing medical jargon whenever possible. Our goal is to give you and your family clear, calm information. Knowledge is a powerful tool. It can help you ask the right questions. It can help you make informed decisions about your care. Remember, a diagnosis of kidney disease is not the end of the road. It is the beginning of a new path, one where you take an active role in managing your health, with your medical team right beside you. Chronic kidney disease, often called CKD, means your kidneys have been damaged and are losing their ability to function as they should. This loss happens slowly, often over many months or even years. It is a progressive condition, which means it can get worse over time if not managed properly. This is different from an acute or sudden kidney injury, which happens quickly. With CKD, the damage is long-term. The good news is that with early detection and the right care plan, you can take steps to slow down the progression of the disease and protect the kidney function you still have. In the sections that follow, we will explore what your kidneys do for your body every single day. We will explain the test doctors use to measure kidney function. This is called the GFR. We will then break down the 5 stages of chronic kidney disease. For each stage, we will describe what it means for your health and what you can do. We will also share stories of real people to help you see what living with this condition can be like. My hope is that this guide empowers you. It should give you the confidence to partner with your doctor and manage your kidney health effectively. Think of your kidneys as your body's most sophisticated filtration system. You have 2 of these bean-shaped organs. They are located on either side of your spine, just below your rib cage. Each day, your kidneys process about 200 quarts of blood. They work tirelessly to sift out waste products and excess water. This waste and water become urine, which flows from the kidneys to the bladder and is then removed from your body. Without this constant cleaning process, harmful toxins would build up in your bloodstream, making you very sick. This filtering job is their most well-known function, but it is far from their only one. They help regulate your blood pressure by controlling fluid levels and by making a hormone that causes blood vessels to constrict. They produce an active form of vitamin D crucial for strong, healthy bones. They also release a hormone called erythropoietin, or EPO. This hormone signals your bone marrow to create red blood cells. When kidneys are damaged, all of these important functions can be disrupted, leading to problems like high blood pressure, weak bones, and anemia, a shortage of red blood cells that can make you feel tired and weak. Let's look a little closer at how the filtering happened. Inside each of your kidneys are about 1 million tiny filtering units called nephrons. Each nephron has a filter called the glomerulus and a small tube called the tubule. As blood passes through the glomerulus, waste products and extra fluid are filtered out. Essential things your body needs, like proteins and blood cells, are too large to pass through and remain in your blood. The filtered fluid then travels through the tubule, where a delicate exchange takes place. Your body reabsorbs the water and minerals it needs, while the remaining waste is sent to the bladder as urine. When someone has chronic kidney disease, these tiny nephrons become damaged and scarred. Over time, more and more nephrons stop working. The remaining healthy nephrons have to work harder to pick up the slack, but eventually, they cannot keep up. This is when waste products and fluid begin to accumulate in the body. Understanding this basic process is important. It helps you see why controlling your blood pressure and controlling your blood sugar are so critical. These measures help protect your nephrons from further damage and preserve your kidney function for as long as possible. So how do doctors know how well your kidneys are working? They use a key measurement called the glomerular filtration rate, or GFR. This number tells your doctor how much blood your kidneys are filtering each minute. A higher GFR number generally means your kidneys are functioning well. A lower GFR number indicates that your kidneys are not filtering as effectively as they should. The GFR is the most important tool doctors have for diagnosing and tracking the progression of chronic kidney disease. It allows them to classify the disease into different stages. This helps guide treatment decisions. To find your GFR, your doctor does not measure it directly. Instead, they estimate it. That's why you'll often see it called eGFR, estimated glomerular filtration rate. Your doctor will order a simple blood test to measure a waste product called creatinine. Creatinine is a normal byproduct of muscle activity. Healthy kidneys filter it out of the blood. When kidney function declines, creatinine levels in the blood begin to rise. Your doctor then uses a mathematical formula to calculate your eGFR. It includes your creatinine level, your age, your sex, your race. Your GFR number is the key to understanding your stage of kidney disease. It's a number you should know and track over time, just like your blood pressure or your cholesterol. When you get your lab results back, ask your doctor, "What is my GFR? What does this number mean for me?" Keeping a log of your GFR results helps you see the trend. Is your kidney function stable or is it declining? This information empowers you to be an active participant in your care. It also helps you understand the goals of your treatment plan. Remember, the GFR is an estimate, and it can fluctuate slightly. Things like being dehydrated or taking certain medications can temporarily affect the number. That's why your doctor looks at the trend over several months, not just a single reading. They will also use other tests, like a urine test to check for protein. Protein in the urine, called albuminuria, is another important sign of kidney damage. Together, your GFR and urine protein levels give your doctor a complete picture of your kidney health. Stage 1 of chronic kidney disease is the earliest and mildest form. In this stage, your GFR is 90 or higher, which is considered within the normal range. However, there is other evidence of kidney damage present. This could be protein leaking into your urine, which a simple urine test can detect, or there might be physical damage to the kidneys that shows up on an ultrasound or CT scan. Most people in stage 1 have no symptoms at all. They feel perfectly healthy. The goal of treatment at this stage is to slow the progression of the disease and manage underlying conditions that could be causing the damage. If you are diagnosed with stage 1 CKD, your doctor will focus on protecting your kidneys. This usually involves managing conditions like high blood pressure, diabetes. Your doctor may prescribe medications to help keep your blood pressure and blood sugar within a target range. They will also recommend important lifestyle changes, eating a heart-healthy diet low in sodium, getting regular physical activity, quitting smoking, maintaining a healthy weight. These steps can make a huge difference in preserving your kidney function for years to come. Stage 2, CKD, represents a mild decrease in kidney function. In this stage, your GFR is between 60 and 89. Just like in stage 1, many people still do not experience any symptoms. You might feel completely fine and be unaware that your kidney function has declined. However, the presence of a GFR in this range for 3 months or more confirms a diagnosis of stage 2 CKD. Often, this is along with other markers like protein in the urine. The goals of management remain the same as in stage 1. Slow the disease and treat the root cause. Your doctor will continue to monitor blood pressure, blood sugar, GFR levels regularly. They will emphasize the importance of following your treatment plan. This includes taking your medications exactly as prescribed and sticking with your healthy lifestyle habits. At this stage, it is crucial to avoid things that can further harm your kidneys. This includes certain over-the-counter pain relievers known as NSAIDs. Examples: ibuprofen and naproxen. Stage 3 of chronic kidney disease marks a moderate decrease in kidney function. It is divided into 2 substages. Stage 3A, GFR, between 45 and 59. Stage 3B, GFR, between 30 and 45. This is often the point when people may begin to notice symptoms. You might start to feel more tired, or have less energy than usual. Some people develop mild swelling, called edema. swelling in the hands, swelling in the legs, swelling in the ankles. This happens because the kidneys aren't removing enough salt and water from the body. At stage 3, other complications can begin to emerge. Your doctor will monitor blood tests for signs of anemia, low red blood cell count, early bone disease. As kidney function declines, hormone production that controls red blood cells and bone health is disrupted. You might need to urinate more often, or less often, or get up at night to urinate. Your blood pressure may become harder to control. This is often when your primary care doctor refers you to a nephrologist. Let's consider a real-life example. James, a 62-year-old man, with a long history of type 2 diabetes. He started noticing his shoes felt tight by the end of the day. He also felt unusually fatigued, even after a full night's sleep. At a checkup, his doctor noted swelling in his ankles. The doctor ran some blood tests. His GFR came back at 48, placing him in stage 3A. The doctor explained years of high blood sugar had damaged the small filters in his kidneys. James was referred to a nephrologist and to a dietitian to create a comprehensive care plan. James's story shows the importance of taking action. He worked with his team to get his blood sugar under better control. He started a new medication to lower his blood pressure and protect his kidneys. His dietitian taught him to read food labels to reduce salt. That helped with the swelling. He learned to weigh himself every morning to monitor for fluid buildup. By making these changes, James stabilized his kidney function and slowed disease progression, giving him a greater sense of control over his health. When kidney disease progresses to stage 4, the damage is considered severe. In this stage, your GFR is between 15 and 29. At this point, you are likely to experience more noticeable symptoms: fatigue, swelling, poor appetite, nausea, a metallic taste in your mouth, itching skin, difficulty concentrating. The complications that began in stage 3, anemia, bone disease. These often become more serious and require more intensive management with medications. Stage 4 is a critical time for education and planning. While the goal is still to preserve whatever kidney function remains, it's also time to prepare for the possibility your kidneys may eventually fail. This does not mean failure is inevitable, but the risk is high. Your nephrologist will start having serious conversations with you and your family about future treatment options. This conversation is meant to empower you, to give time to learn, think, and choose. Let's look at the story of David. David was diagnosed with stage 4 kidney disease due to uncontrolled high blood pressure. His GFR had dropped to 22. His nephrologist sat down with him and explained it was time to prepare for renal replacement therapy. That means finding a way to replace the work his kidneys could no longer do. David learned about dialysis, kidney transplant. He was given brochures. He was connected with a nurse educator who specialized in kidney failure. David and his wife attended a class about hemodialysis, typically done in a clinic. They also learned about peritoneal dialysis, which can be done at home. He began the medical evaluation for transplant candidacy. His doctor explained he would need a special access point created in his arm. That procedure needs to be done months in advance. By starting planning early, David felt less anxious and more prepared. He knew what was coming and had a say in his treatment path. Stage 5 of chronic kidney disease is also known as end-stage renal disease, or ESRD. This diagnosis is made when your GFR drops below 15. At this point, your kidneys have lost most or all of their ability to filter your blood effectively. Harmful levels of waste and fluid build up in your body, a condition called uremia. The symptoms are often severe. People in stage 5 typically feel very weak and sick. Nausea, vomiting, loss of appetite, muscle cramps, trouble breathing due to fluid in the lungs. Without treatment to replace the work of the kidneys, stage 5 is life-threatening. The treatment options are dialysis kidney transplant. Dialysis is a medical procedure that artificially cleans your blood. There are two main types. Hemodialysis uses a machine to filter blood outside your body, usually at a clinic a few times a week. Peritoneal dialysis uses the lining of your own abdomen to filter your blood. It can be done at home every day. A kidney transplant involves surgically placing a healthy kidney from a donor into your body. A transplanted kidney can restore function and offer more freedom than dialysis. Consider Sarah, who had lived with diabetes for over 20 years. Despite her best efforts, her kidney function slowly declined over the years. When her GFR fell to 14, she started experiencing severe nausea and had no energy to get out of bed. Her doctor told her it was time to begin dialysis. Because she had planned ahead with her medical team, she had already had surgery to create an access for hemodialysis. She began her treatments at a local dialysis center 3 times a week. The first few weeks were an adjustment, but soon the dialysis began to remove the toxins from her blood. Sarah's energy slowly returned. The nausea subsided. The care team at her dialysis center became a second family. They helped her manage her complex medication schedule. They taught her about the renal diet, which limits certain minerals like potassium and phosphorus. Sarah also joined a support group for dialysis patients. She found comfort and practical advice from others going through the same experience. While her life had changed, Sarah found a new routine. She learned that, even with kidney failure, it was possible to live a meaningful life. Her story shows that with a strong support system and a good care plan, you can navigate this final stage. No matter what stage of kidney disease you are in, there are powerful steps you can take to protect your health and slow the progression of the disease. Partner with your doctor, actively follow your care plan. This starts with controlling your blood pressure. High blood pressure is a leading cause of kidney damage and can make existing kidney disease worse. Take your blood pressure medicines exactly as prescribed, even if you feel fine. Your doctor will give you a target blood pressure goal. Work to meet it. If you have diabetes, managing your blood sugar is equally critical. High blood sugar can damage the delicate filters in your kidneys over time. Monitor your blood sugar regularly, take insulin or other diabetes medications as directed, follow dietary advice from your doctor or dietitian. Simple lifestyle changes also play a huge role. Limit salt in your diet to help control blood pressure and reduce fluid buildup. Stay active with gentle exercise like walking. If you smoke, quitting is one of the best things you can do for your kidneys and heart. Be careful with medications. NSAIDs can be harmful to kidneys, especially if your function is reduced. Ibuprofen, naproxen. Always ask your doctor or pharmacist if a medication is safe before you take it. Prescription drugs, over-the-counter pills, herbal supplements. Keep an updated list of all your medications and bring it to every doctor's appointment. This helps your healthcare team make safe choices. See your kidney specialist, nephrologist, as recommended. They have the specialized expertise to manage kidney disease. Keep all appointments, get your lab tests on time. Ask for copies of your lab results. Keep a folder at home, track your GFR, track other important numbers. By taking these actions, you are not just a patient. You are the manager of your own health. You are taking control of your condition and giving yourself the best possible chance for a healthier future. Receiving a diagnosis of chronic kidney disease can feel overwhelming and isolating. You may feel anxious about the future or confused by all the new information. It is important to remember that you are not alone on this journey. Your first line of support is your healthcare team. Primary care doctor, nephrologist, dietitian, nurse, social worker. They provide medical care. They answer your questions. They connect you with resources. Do not be afraid to ask for help or to say that you do not understand something. Family and friends are another crucial part of your support system. Driving you to appointments, helping prepare kidney-friendly meals, they provide emotional support. Talk to your loved ones about what you are going through. Let them know how they can help. Sometimes, just having someone to listen can make a world of difference. Encourage your family to learn about kidney disease with you. When they understand your condition, they can be better partners in your care. Many people find strength by connecting with others living with kidney disease. In-person support group, online support group, share your experiences. Ask for advice. Learn from people who understand. Hearing stories of resilience and hope can be inspiring. Hospital social worker can help. Organizations like the National Kidney Foundation can help